Dr. Rose-May Seide, before we get too much into the topic of the day, tell us a little bit about you, please.
Hi, everybody. Yeah, I want to hear you because I want to interact. I don't want to feel alone here on that chair.
You should have enough energy to give her a warm welcome. Please, give a warm welcome to Dr. Rose-May Seide.
So, in a nutshell, a little bit about myself. I'm an immigrant from Haiti, of course. And I'm a wife, a mother of 4 children, my 2 girls and 2 boys. My oldest serves as a major in the American Army. My second is a lawyer in Washington. My third just got accepted in family medicine at Jackson Memorial, same residency training that I did 26 years ago, so I'm really excited. And then my fourth says he wants to enter the medical profession, so we're waiting. He's studying right now. I'm also a grandmother of 2 beautiful young boys. And that put aside, I'm a family physician. I studied medicine in Haiti and then came here to Miami, was accepted to start a residency training in family medicine at Jackson Memorial Hospital, where I did 3 years. Then I stayed working in their ER part-time for 9 years while working in private practice. I worked at the same place for 20 years, taking care of mostly the Haitian community because that's what was in my heart. I wanted to come here, go back to Haiti, but in second year, I realized that it was more opportunities for my family here. So I stayed here, but I had decided to always serve my community. So that's why I worked 20 years serving mostly Haitian patients. And in 2021, I decided to take a leap of faith and go on my own, open my own practice, Prima Health Center, that now has been serving the same community that I love for 3 years. So that's me.
Wow, thank you. What a great way to enter spring and celebrate Cause Femme International. First coming out now because Cause Femme Network has been around. So Cause Femme International is more about doing some work in the community and abroad. And adjust the volume, because to me every day we have to adjust the volume. So this podcast is really going to help some women dealing with the issues of menopause. And thank you so much, Dr. Seide, for being here. And once again, I'm Guylene Berry, and I will be your host today, talking and asking you questions about menopause. So to all of you that are here and tuning in to Adjust the Volume podcast, can you please tell us a little bit more about menopause? So I learned about the term of, I heard of menopause a long time ago, but perimenopause and postmenopause? Like, it's like a long life thing. So tell us more about this issue of menopause, whether it's perimenopause, menopause, or postmenopause.
Okay, first let's understand even the term. Because if you look at ancient writings and you try to look for menopause, you find that there's not a lot of writings about that. Aristotle, who lived in 250, 300 before Christ, he mentioned it as something starting for women around age 40. But it's not until around 1812 that a Parisian medical student by the name of Charles Pierre-Louis de Gardanne, he coined 2 Greek words. He took the word mens, that means months, and the word pausis in Greek, that means cessation, and he put those 2 together, and that's how the term menopause was born, because it was the cessation of menstruation in women, all right? So in 1821, the term became official. So this is how the word menopause was born. Now, in the 1930s, they thought that it was a disease that was caused by certain deficiencies. And that's why you read in the literature some interesting anecdotes where they came up at the time with a bunch of different supplements that they thought could cure this disease. For example, they were giving women testicular juice, or they were giving them crushed ovaries from animals. It's just to tell you that they didn't really understand the process. Now, in the 1938, that's when they created the synthetic estrogen. But it's only around 1970 that they fully understood that menopause was just a deficiency in the hormones that support menstruation. So it was a deficiency in estrogen and progesterone. So around that time, the pharmaceutical companies flooded the scene with, all in full force with the hormone replacement therapies, because they came up with all the advertising that all these replacement therapies were the ultimate liberation for middle-aged women. So the hormonal replacement therapies were, the synthetic estrogen and progesterone that were taken a lot at the time to solve the symptoms of menopause. So menopause, what is it simply? It's simply the cessation of menstruation in women for 12 months. Mm-hmm. So you need to have 12 months of no menstruation, and that's what's called menopause. Now, perimenopause, you asked me. Perimenopause is the period that leads to the menopause. It can start around 40 in general, and for each woman it can be different. But it's when the ovaries start creating less and less of the hormones that support the menstruation. So you can start having, menstruation that is less frequent, menstruation that becomes less abundant or more abundant. So it leads to the menopause, that is the period of 12 months without menstruation. Now, post-menopause is the period after. The woman has been 12 months without a period. We know she's in menopause, so all the period after is the post-menopause. So I hope that answers the question.
Wow. You know what? With everything that you have said here, Dr. Seide, as a woman, I understand some of it. And for the men that are here in the room, what should they know about menopause?
So basically, menopause is not a disease like they thought in the early 20th century. It's not a disease, it's a normal aging process. Can we cure menopause? No, we cannot cure menopause. Can we make symptoms better? Yes. Mm-hmm. Can a woman go throughout her whole life without going through menopause? No. So menopause is a normal aging process. If you live long enough to get to that stage where your ovaries as a woman stop producing the estrogen and the progesterone that support the menstruation, you're going to go through menopause. Okay? So you want me to tell the men what they should know about menopause. Yes, to support the women in their life. Okay, so
whether it's
hopefully
someone close to you or your mother or sister.
Absolutely. The men have a great role in helping their partners, their wives, their family members through that stage of their lives, because every woman is going to experience it differently. Some women will tell you that they had no symptoms. Some women will have few symptoms, and then you have other women that are telling you that it's impossible for them to tolerate the symptoms, like it's really rough on them. So for the men in their lives, the first of all, you educate yourself and find out about the condition, because everybody is living it differently. So a man in a woman's life needs to listen. You listen to the woman. You talk to her. You ask her, how does she feel? You ask her, how can you help? Mostly, the men in a woman's life at this stage of our lives, you just have to be present. That's what I would give as an advice. Be present. Because it's real. And you know, some of you, it's not going to be like a big problem, even with little things, for example. Because you know, with menopause, some women have terrible hot flashes. If she puts the AC down, don't tell her that it's going to cause the electricity more. Like, you know. Be understanding. It has nothing to do with you, okay? It's a natural process. Just help us through it.
Thank you for answering that. Some women may be hot, some women may be cold. So I have a lady that I met, and she's like, you know what, sometimes I experience both symptoms. I'm hot in the top, on the top, and cold in the bottom. So she has the AC on and the heater on. So is that possible?
She can do whatever she wants, okay? She's going through something rough. That can be rough.
So talking about menopause, some people have it really bad. So what are the different symptoms? And also, is there a way that people can reduce? We're gonna get to the preventive side of menopause.
We can talk about it together.
However, there are some medications for women going through it. So I'd like for you to cover the medication, and then we'll get to the preventive.
All right. So what are the symptoms of menopause? As I say, women are different. Some women won't have symptoms or have very few symptoms, but some others will experience certain symptoms that they may feel are not, you know, very tolerable or for which they need help with. So let's talk about the symptoms. First of all, you start by having changes in the menstruation, as I'm saying, you know, because we have perimenopause, menopause, and postmenopause. But in perimenopause, menopause, you're going to have some differences in the way the women have their periods. They can be more, they can be less, you know, blood flow. They can be more frequent, less frequent. You know, there's not a real schedule to it. It becomes irregular. Now, the other thing is that we have the hot flashes. Hot flashes in the Western world is what women complain the most about. The hot flashes where the body temperature increases, they feel really hot, they're sweating, and a lot of them happen worse at night, where, you know, the woman can feel their skin clammy, you know, they're uncomfortable. Some of them feel dizzy when they have the hot flashes. So it's like heat that comes and invades the body, and then it goes away. So at the beginning, it's worse than after. Other symptom is that the women can have more urinary tract problems. So you have some women who have more frequent urinary tract infections. Being a woman already puts you at risk of having more frequent urinary tract infections, but with menopause it becomes worse because, you know, the skin is thinning down there, and it puts you at more risk of getting the urinary tract infection. Other symptoms is that, you know, they can have weight gain that they don't like, because they're like, I used to eat like this before, never gain weight, now I'm gaining weight. You know, that can be one thing. And then headaches, decrease in sexual desire, decrease or more time for the arousal. All these things that they didn't have before that start changing, and they're noticing it. And then you have all the emotional symptoms. Some women experience sadness, they experience anxiety, you know. So all these like mood swings. So once you understand that, when you're in that person's life, you understand that it's nothing personal. It's because that condition that is linked to the fact that your ovaries at that period of your life don't produce the estrogen, the progesterone that they use to produce. Now all these things are causing that, for example, the women, they have fatigue, they sleep less, and when you sleep less, you're more irritable. So all these things are symptoms of menopause.
That sounds complicated.
Not really. You guys think it's complicated? I hope I'm explaining clearly.
So with all these things going on with menopause, perimenopause, postmenopause, if a woman is experiencing perimenopause, can she get pregnant?
Absolutely. Because perimenopause doesn't mean that you cannot still become pregnant. So in perimenopause, you start having a sharp decrease in the production of estrogen and progesterone. But during perimenopause, you can still become pregnant. So you still need to, use protection.
Wait.
Yes.
So can you imagine someone is going through all this and still get pregnant?
I can't just imagine. It happened to my own mother.
So talking about this, as a doctor, can some of the medicines cause people to have menopausal symptoms?
Okay, there are certain things that can cause you to, for example, if you have surgery and they remove your ovaries, even if, let's say, you're 30, then it's surgical menopause, because if you don't have ovaries, you can no longer, ovulate and have periods. That can cause. And then you have certain medications that can, put you in a state that is like menopause, where it stops your menstruation. Like, for example, there is a medication called Lupron that they give sometimes for, patients who have prostate cancer, or even women that they want to stop their blood flow because the anemia is so bad that they need an anemia, let's say, due to a lot of vaginal bleeding. They want to stop the menses for a few months. If you get Lupron, for example, it stops your menstruation, so it's kind of menopause. You have the hot flashes, etc. And then people who are undergoing chemotherapy. Chemotherapy can put you, in a state of menopause where you don't have periods, because the chemotherapy works on rapidly dividing cells, and the ovaries have rapidly dividing cells. So these things can cause, symptoms of menopause, and they can cause the women to not have periods for a period.
Okay. Have you guys learned anything new today? Yeah. Thank you. I have a question for the men in the room. Do men have some kind of menopause?
I'm very happy you asked that, because the men may think maybe they don't talk about it as much, but there is a condition called menopause, and they actually refer to it as andropause. And it's the period, middle of their lives too, where they start having a decrease in the production of testosterone, and they experience some symptoms like fatigue, decreased libido, sometimes mood swings. So yes, men go through that too, not the hot flashes really, etc. But men go through periods of their lives where they have to adjust also. I sometimes smile when patients, male patients come to me, "Doc, it's not like, I'm not like before." And I'm bothered because, I needed to be like before. I'm like, you need to learn to enjoy that phase of your life, and you don't need to do it more. Make what you do count, right?
So now that we're talking a little bit about conversation between men and women, when you were talking about the women, I heard silence when we started talking about some kind of, do men experiment? I hear like the voices, kind of like, I hear some of the voices in the room. So before we get to that, I think that it's very important for men and women to have a conversation. So when they get to that season in their lives, so there is an understanding so that they can manage to have still a loving relationship.
Of course.
And try to get along with each other. Because as you heard Dr. Seide just mention, both men and women, when going through this period in their lives, they are dealing with some emotional issues as well. So with that being said, there are some young people in the room as well. What can our young people do to, as a preventive precaution to ease the symptoms of menopause? What should they do?
Okay, for the young ladies, okay, I think that it's extremely important that they educate themselves, that they know what it is and they know what's coming, because if you live long enough, it is going to come. You cannot avoid going through menopause if you're alive and you're going to get to that age. So when you educate yourself, you understand what you're going to be going through at that time, because knowledge is power. And once you understand, I feel that you're more ready to face what's coming. Also, for young women, you need to talk to your mothers, your aunts, your grandmothers, and ask them. Because a lot of times, a woman, she will have her menopause around the same time as her mother. Even if it's not, let's say you don't have your mother, you can speak to your aunt, to friends who have gone or are going through that period of their lives. And then how do you prepare? You prepare by keeping your body physically active, because when you exercise well and you keep your body healthy, you go through it easier. If you're drinking a lot of alcohol, you take the habit of not drinking that much, because it doesn't help. If you're a smoker, think about quitting. Smoking doesn't help with anything. Eat well. Make sure that you put enough fruits, vegetables, grains, fish, like good oils. Like, make sure that you put in your body all those nutrients that are going to help you be healthy, so that way when you get to that stage, you know your body is healthy, so you're going to experience it less. And then do relaxing things, be happy, enjoy every part of your life, because menopause is not something to be afraid of. It's a stage that you're going to go through, and it's going to depend on how you decide to see it, how you decide to look at it, you know. I'm not saying that some women don't have the symptoms really bad, but I feel that if mentally you are prepared, if intellectually you know what's happening, you're going to face it differently than somebody who just feels that you're the victim of all the symptoms that are happening. So this is my advice for young people.
Okay, thank you. Anything else you'd like to add before we get to questions around the room?
Well, quickly, now that I said what you can do, of course there are medications. Some women choose to take medication, the hormone replacement therapies. The research has shown that for most people it's more detrimental than beneficial, so you really have to have the conversation with your doctor, because it doesn't cure menopause. You cannot cure menopause. You can help the symptoms. And so the hormonal replacement therapy are there to help symptoms. Okay? Now, in general, they recommend to take it. There's not a set period of time when you can take it, but it's recommended to take it if you decide to take it between 2 to 5 years, because anyways, that's the period when the symptoms are worse. And if you decide not to take medication, which is probably better for most women, there are a lot of little things that you can do. Like, for example, you know, you can put the the air down so you're not as hot with the hot flashes. You can wear layers, so when you feel hot you remove layers. You wear cotton because it's a material that breathes. And then, as I said, exercise, drink lots of fluid, sleep well, because if you sleep well you're not as tired, so it's not as bothersome for you to feel all the symptoms. If you have the emotional problems, you can do psychotherapy, speak to somebody. And then you have little things that can help, like for example vaginal dryness. I don't know if I mentioned that, one of the symptoms of menopause. You have some estrogen creams, or you have even over the counter some lubricants. You can take the pharmacist on the side and ask them for the best lubricant to help you. It makes having sex more pleasurable than having pain down there because it's so dry. And then there are some herbal supplements that some people recommend. They talk about black cohosh, dong quai, walliam, but what else? I'd like to talk about quickly what we call phytoestrogens. You may hear that term and you may want to know what a phytoestrogen is. Phytoestrogens are plant-based substances that you can find in certain legumes, in certain